when nurses break the rules of giving medications. If you're a legal nurse consultant helping attorneys with medical malpractice cases, you'll see nursing errors involving medications. This is Pat Iyer. I've been analyzing medication errors for over 30 years. Here's a nursing home case that was reported in the January 2018 issue of Medical Malpractice Verdicts, Settlements, and Experts. An 85-year-old woman was admitted to a rehabilitation facility after she sustained a fractured hip. She was on Coumadin for atrial fibrillation, and she needed INR, which is International Normalized Ratio, NPT tests for prothrombin time. When her INR showed she needed a higher dose of Coumadin, somehow a nurse noted the physician stopped the Coumadin. After 14 days of being off Coumadin, the patient had a stroke with permanent right-sided weakness. The plaintiff maintained the rehabilitation facility was negligent and violated the Nursing Home Care Act by failing to administer the Coumadin as ordered, failing to follow the facility's policies and procedures, and failing to recognize that the stop order was inconsistent with the patient's care plan and bring that to the doctor's attention. The estate also contended the doctor was negligent in giving a telephone order to discontinue the Coumadin despite the subtherapeutic INR level, in failing to discover that it had been erroneously discontinued, even if he did not give the stoppage order, and in failing to restart the Coumadin. The attending physician denied ever ordering discontinuing the drug. The doctor asserted the nursing staff failed to properly document the purported order, so he could have discovered and corrected the medication error. The rehabilitation facility contended that the attending physician was at fault because he did give the discontinuation order, which was written in multiple places within the decedent's records, where he could have seen it if he had looked at any time in the 2-week period prior to her stroke. They claimed there was no reason for the nursing staff to question the doctor's order regarding the discontinuation order. Here's where I disagree. The jury found in favor of the attending physician and the rehabilitation center's administrator, but they held the rehabilitation facility liable for the decedent's treatment and eventual death. The jury awarded $4.1 million in this Illinois case. In my experience, this is a high verdict for a nursing home case. As you've heard, the issues surrounding a he said, she said type of conflict resulted in questioning how did the Coumadin order get stopped? Shouldn't the nurses have questioned it if the patient had atrial fibrillation and a low INR? What do you think? Be sure to go to legalnursebusiness.com and pick up your free reports on our website and leave a comment below this video.